Skin peeling has been around for a long time. There's various acids and various other chemicals which can be used to remove the top layers of the skin. When one removes the top layers of the skin, the actual color of the skin improves. The blood supply to the skin improves, so the complexion improves. At the same time, if you're doing superficial peels, which have a downtime of 2 to 5 days, one can see a big improvement in removing some of the pigmentation in the skin and the brownness in the skin. Peels are often done very mildly where there's no downtime and the skin complexion looks better right away. Skin peels can also be used to remove wrinkles, but then one can have downtime of 10 days to 2 weeks. So it depends on the various kinds of peels and the concentration of the peels. Most peels today are done together with a facial and have no downtime. It's just a procedure to remove top layers to give a better complexion, to take away some of the roughness of the skin. Skin peels can have a dramatic improvement for patients. And if one does multiple peels in a year, one can keep the condition of the skin in tip-top shape. And can also slow down some of the wrinkling that may occur. So skin peels are very frequently performed in the salon, in the doctor's office. It's one of the most common procedures done for rejuvenation of the face. There are many different kinds of skin peels. In fact, most facials that are done have a skin peel element, and this just helps with improving the complexion, removing dead skin, superficial layers, improving the vascularity of the facial skin so that one's complexion is better with a pinker look to the face. One can use skin peels to remove brown spots, pigmentation, various kinds of pigmentation, as well as improve some wrinkling if one does a stronger peel. We do many peels. We do strong TCA, trichloroacetic acid peels. In fact, I love doing peels. One of the problems is that in the summertime, if one does a stronger peel and the patient goes out in the sun, they will get a rebound hyperpigmentation. So the stronger peels are usually reserved for the wintertime. But patients are amazed at the results they get when they do stronger peels in the office with slight discomfort, with 2 to 5 to 6 days of downtime in terms of peeling, but the results are absolutely amazing. So depending on the strength of the skin peel, one can expect varying results. One always sees a result after a skin peel. If you remove the top layers of skin, there's always an improvement in the complexion, in the shininess of the skin, even with a very slight peel. If one does a deeper peel, one's always going to see a big improvement, especially removing brown spots and various kinds of pigmentary dyschromias of the skin. So one always gets a result when one does a TCA peel. So anybody who has skin damage, whether it be rough spots, keratoses, senile, solar keratoses, age spots, pigmentation issues, these patients are all great candidates for this procedure. And it's just surprising how more people don't do skin peels. And I think they're not promoted enough by the aesthetic community. Skin peels it's a great treatment for many patients. Today with skin peels, we are careful not to do the very strong peels, which were the phenol peels or the high concentration trichloroacetic acid peels. With those procedures, which have 10 days of downtime, there's always the possibility of losing some pigmentation or getting some scarring. So we use moderate depth peels today, and the complication rate is extremely low. One can control the amount of damage to the skin and get good results without any side effects.